Good afternoon. Thanks for joining us for our weekly press conference, especially on the COVID-19 situation. I'm Larry Holsey, Director of Municipal Information for the City of Waco, and we're from the third floor conference room in Waco City Hall. We've actually got 4 people here. We're social distancing, but we all have our masks on as well. So we're trying to do everything to suggest that this is the way to do it. Joining me today is, again, our Mayor, Kyle Deaver. Also Dr. Jackson Griggs, and today, in stepping in for Judge Scott Felton, who had a previous engagement, is Dr. Farley Werner, who is who is the authority for the Waco Mclennan County Public Health District. We're glad to have him here. Give you a rough how we're going to conduct our press conference again today. We'll let each one of our specialists give us an opening comment, whatever's on their heart and mind. Then we'll answer questions that I've gathered throughout the week from various news media and across the community, and then we'll open it for those who are on our call from the media who have registered previously. This is being recorded downstairs in our studio in all Spanish, and in a moment I'm going to ask Hector Sabito, our council member for District 2, to introduce that. But we're also doing an American Sign Language translation, so we make sure that all the community in all segments are able to get the information that's coming from this press conference. So Hector, I will always appreciate you and being a part of this, and if you would still please give us an invitation to our Spanish speakers.
Absolutely, thank you, Larry. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video, y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, thank you again.
Thank you, Hector. Appreciate that big time. Let's get started, if we will. We'll start off with opening comments, and we'll start with, if we will, Dr. Werner, would you introduce yourself and tell us what's on your mind right now?
Farley Werner. I am the Waco Mclennan County Public Health Authority, and speak on the issue of the delayed school opening. Currently in Mclennan County, we're experiencing a dramatic increase in community spread. This has resulted in a severe surge in COVID-19 cases. We've had a period of exponential growth in the number of cases, and this has resulted in a dramatic increase in hospitalizations and now deaths. Hospitals and providers are working to deal with increased demands. We are currently at a point where additional increase in spread of COVID-19 and increase in cases would be poorly tolerated. The impact of opening of schools on the spread of COVID-19 illness in communities can only be estimated at this time. There are countries such as Denmark and Finland that were able to reopen schools, but others such as South Korea, Israel, and China were forced to reclose when they opened in the earlier part of the epidemic. The reopening of schools can reasonably be expected to result in some increases in cases in our community. While children are less likely to contract and transmit infection than adults, new cases will occur and then contribute to household spread and then community spread. Since the onset of the surge of cases in Mclennan County, school-aged children have accounted for 332, or 12.8% of recognized cases. This is higher than expected. It's estimated that the number of actual cases of COVID-19 may be 10 times the number of cases confirmed by a positive test. Children are more likely to have asymptomatic infection, and this would mean that the actual number of school-aged children who have had or will get COVID-19 may be considerably higher. Bringing together students, teachers, and school staff in the setting where, although every effort to social distance is being made, it's still a setting where it's difficult to consistently maintain effective social distancing. Extracurricular activities bring together students, families, and friends, where again, social distancing and mask use can reduce the risk of transmission, but not prevent it entirely. Additionally, a large number of students in the county are cared for by grandparents, and these grandparents are at significantly increased risk of severe infection. Again, reopening of schools can reasonably be expected to result in some increase in spread of COVID-19 in the community at a time when such an increase poses significant danger. Currently, the exponential growth of COVID-19 activity appears to be leveling off, possibly decreasing, but still at an unacceptably high level. This is still a high level of hospitalizations, and what we've seen recently is a continued increase in the number of deaths. Postponing the reopening of schools can delay this potential impact and allow for additional control of the epidemic in the interim. Thank you.
Dr. Griggs.
Thank you, Larry, and thank you, Mayor. And it's good to see you, Dr. Werner. Just for Waco, Mclennan County, Dr. Werner is a physician who is profoundly respected across the entire medical community. I feel honored to call him a colleague, and across inpatient hospital settings for a number of years, he's consulted on some of my most challenging cases and has helped tremendously with his wisdom and care of patients. So I feel a sense of deep gratitude that he functions as our health authority in Mclennan County, and I trust him as a clinician, and feel a kind of a longstanding sense of gratitude to him. So, but as I've done in previous press conferences, I'll start kind of with the big picture and then zoom in on Mclennan County. Globally, we're at 15 million cases of COVID-19 and over 600,000 deaths. In the United States, we're just shy of the 4 million mark in terms of confirmed cases and 142,000 deaths. While the United States represents just over 4% of the global population, we're approaching about a quarter of the global cases and deaths from COVID-19. And in terms of actual deaths, let me provide some reference. The top killers in the United States are heart disease and cancer, each of which account for approximately 600,000 deaths each year in the United States, which is about 1,600 deaths per day on average taken over the course of the year. And in recent week, we in the United States are approaching about 800 deaths per day from COVID-19, which on a day-to-day basis makes this the number 3 cause of death in the United States. Now, shifting to state numbers, the Texas Department of State Health Services indicates that there are 342,000 cases reported to date in Texas. There have been 4,151 deaths in our state, and the positivity rate in Texas is approximately 15% at this point. In Mclennan County, the updates as of this afternoon, the total number of confirmed cases is 3,688, 1,664 of which are currently active. As of this afternoon, the Public Health District has received notification of 113 new cases of coronavirus. There are currently 77 hospitalized patients with COVID-19. 15 of those hospitalized patients are requiring mechanical ventilation for respiratory support. While both hospitals continue to have ample capacity to manage new COVID-19 cases within their isolated surge spaces, and for the immediate future, there is, in the immediate days ahead, there's no need to activate our alternative care site, our surge site, saying that the Emergency Operations Center continues to prepare so that if needed, the alternative care site, the surge site, can be mobilized within just a few days warning. To date, there have been 25 total deaths. Actually, that figure is as of yesterday. I don't have today's numbers, but 25 deaths as of yesterday. The total tests completed on Mclennan County residents is 29,000 tests. Another 6,500 have been performed in our county on non-county residents. 57% of the COVID-19 cases in our county have been among Latinos. To put that in context, that is twice the Latino percent of population in the county. So the Latino population continues to suffer a disproportionate burden of this disease in our community. The RT, that's the effective reproductive number that I've reported on our ongoing basis. The UT, University of Texas School of Public Health, now has a website that is looking at counties in Texas and the RT number. Mclennan County, they have now at 0.9. And the Children's Hospital of Philadelphia, which I've used before, their policy lab has our RT number even a little lower than that. Within nursing homes in Mclennan County, there have been a total of 13 facility outbreaks. An outbreak in long-term care facilities or nursing homes is defined as at least one resident, so one or more residents having a confirmed positive case. So 13 facility outbreaks. 5 facilities have had more than 25 individual cases to date. There have been 2 deaths from long-term care facilities or of residents of long-term care facilities within the past week. And there have been a total of 8 nursing home related deaths due to COVID-19 to date. At the county jail, there are 5 active cases among staff members and 7 active cases among inmates. So in summary, from my vantage point, the daily counts are stable, and while high, they are at least not continuing to rise. So in a period of escalating concern about hospital capacity, this may be early positive news, but hospitals are still very much stressed, and there's really not wiggle room for and certainly no room to take any chances at this point. Our estimated effective reproductive rate is down, mostly owing to changes in the community's health practices. The most important change over the past month being, of course, the mandatory masking that we're all doing now. Our mortality rate has, as expected, risen with case counts, and we must just continue to practice masking, physical distancing, at least 6 feet, avoiding indoor crowded spaces with non-household members in order to continue to bring that mortality rate down. Our collective behavior is the most important factor determining how many people in our community die of COVID-19.
Thank you, Dr. Griggs, and we certainly miss Judge Felton being here today. He is always a source of great wisdom and the county authority, and he also usually has one or two one-liners that are zingers. So if Dr. Griggs and Dr. Werner, if you all have anything you want to share along the way, along those lines, we would appreciate that. I also want to thank Dr. Werner for being here. As Dr. Griggs said, he is a extremely well-respected infectious disease specialist here in Waco, practicing doctor who serves as our Waco Mclennan County Health Authority. He has been a trusted advisor to Judge Felton and me as we have had to make difficult decisions, as well as to the council and the county commissioners. And Dr. Werner, I appreciate you taking the time to be here today. As mayor during this pandemic, I and your city council have been faced with many difficult decisions. So I certainly appreciate the difficult decision that Dr. Werner had to make regarding issuing the order to delay school's in-person start. This doesn't delay the start of instruction, but it does delay in-person school and extracurricular activities. And we know that that impacts students and parents in many ways, but Dr. Werner had to make a decision that he felt was best for the public health. I think given the current condition that we have of a still very high positivity rate and high number of cases, although the number of cases per day has been declining on an average. We'll talk about that in a minute. I think I appreciate the fact that he's made this decision for our community. So thank you for that, Dr. Werner. I'd like to turn now to a few slides and talk a little bit about what's happening here in our county. This first slide is the slide that we see every week, starting back with our first case on March 16th. Again, we were very, extremely low until the first week in June when things started taking off, and we saw that exponential growth for several weeks. We have slowed that growth a little bit, and this chart is the same chart, but starting on June 1st, where you can see the line for cumulative cases start to flatten just a little bit. Looking at hospitalizations, again, we never got above 8 hospitalizations in the first part of this pandemic. We have hit as high as 77. We're back down to, I believe, 74, 75 at this point. But still, our hospitals are stressed. And again, this is looking, again, just from June 1st so that you can see the data a little bit better. Our hospitals are stressed primarily from a staffing standpoint, primarily from a nursing and other professional standpoint. We have good coverage from doctors, but we are starting to definitely strain the capacity of our nursing staff. This is showing you what's happened with our new cases over the last, since June 1st, last about 7 weeks. You can see that our peak of new cases was around July 6th and 7th and on a rolling 7-day average basis. That number has come down from at its peak a little over 150 to a little over 100 now. So that is a good sign in terms of new cases. One thing that you need to see is this is the blue lines here, the blue bars are the 7-day average of new cases. Dr. Werner has talked about this, Dr. Griggs has talked about this, but this is the orange line is hospitalizations, and it is on a separate scale from the new cases. The new cases reached a high of about 150 again on a 7-day rolling average, and our hospitalizations reached almost 80. But you can see how those trail behind the spike in new cases. So hopefully, as we have seen these new cases start to go down, we will see that orange line of hospitalizations begin to come down, but it's way too early to call that a trend. That's really just a data point at this point. Texas positivity rate rolling average has started to decline a little bit from its peak. So we will hope that that is the beginning of a trend. But if you look back about a week earlier, we had the same sort of thing, and then it took off again. So we're going to hope that we don't see that. Same thing with Mclennan County's rolling 7-day average. We had one day about 8 days ago where we had a 40% positivity rate. That has finally rolled out of the numbers, and that's why you see this big drop as of the 20th. So again, it's too early to call that a trend. It's more of a data point, but it does show that we had been leveling off in our positivity rate. So hopefully we start to see that come down, particularly given the data that Dr. Griggs just shared regarding the RT factor of 0.9 being less than 1 is a very good sign. That's all the slides I have. I did want to mention that we have, let me see here. That we have some free testing coming up here over the next 2 to 3 weeks. The Waco Mclennan County Office of Emergency Management has partnered with the Waco Mclennan County Public Health District and the Texas Department of Emergency Management to offer free COVID-19 testing sites in July and August throughout Mclennan County. On July 27th, 28th, and 29th, there will be free testing at the Waco Multipurpose Facility at 1020 Elm and at University Baptist Church at 1701 Dutton. July 30th, there will be free testing at Tolliver Chapel Missionary Baptist Church at 1402 Elm. On August 3rd, free testing at McGregor High School, 903 Bluebonnet Parkway in McGregor. And August 13th through 15th, there will be free testing at the MCC Highlander Gym at 171 Powell Drive. Each of those days, there will be a maximum of 600 tests given. The tests, again, are no charge. So if you are concerned that you may have COVID-19, this is a good time for you to get tested. And I want to thank again the Waco Mclennan County Office of Emergency Management, the Public Health District, and the Department of Emergency Management for coordinating to make that happen. That's a very good thing for our community. At this time, Larry, I'll turn it back to you to ask some of the questions that we've received from the press and others.
Okay. Well, thank you for mentioning that free testing. For all media people, we'll be sending out a press release later this afternoon with all the full details of that, so you won't have to worry about that. I'm sure glad Dr. Werner's here because, as you can imagine, after the order issued yesterday, we've had a number of questions come in. So, Dr. Werner, first question for you: did you consider the problems you might your order might cause for parents who work?
Well, yes, of course. The epidemic has certainly profoundly affected all of us in many ways. Parents will definitely have effect from a delay in returning to in-person school. This, along with other factors certainly considered, the overarching concern remains the public health, and the decision was made on that basis, and we have to move forward.
Kind of a follow-up to that, did you consult with school superintendents or athletic directors before issuing the order yesterday? If not, why not?
The short answer there was specifically no. It would not have been possible to consult with all. The potential effect of postponing the opening of in-person school and extracurricular activities certainly considered, but ultimately the decision was based on epidemiologic issues and public health issues.
Okay. Last week you thought we might be slowing the spread. Now school has been delayed. Why?
Yeah, I think I said last week that there were signs that we might be slowing the spread, and I think that there are signs that we are slowing the spread. The fact that our new cases per day have slowed down, the fact that our positivity rate has leveled off and may be starting to move down, and the fact that our RT value is somewhere between, in the range of 0.9. Again, that RT value, as Dr. Griggs has explained in the past, is the number of people that a person with the disease is likely to infect in the community. And if it's less than 1, that means the disease should start slowing in your community. If it's more than 1, it is going to start spreading more rapidly. And so the fact that we have gotten it down, where do you remember what the highest it was, Dr. Griggs, that you saw?
The highest that I saw was over 4, and that has been, now several weeks ago. Right. It was over 4.
And that's a terrible number. And so, just the difference between 1 and 1.5, as I understand it, can be a pretty big difference. So the fact that we are now under 1 is a good sign. So I think reality is we probably are slowing it, but we don't need at this moment is some new event that would cause that to reverse. We need to get it back under control as quickly as we can.
Dr. Werner, are you privy to information or data the public has not seen that led to this decision? Or are you seeing something in the data that has not been discussed before?
Well, the decision was based on an overall assessment of the current status of the epidemic locally. Some specific information data would be the number of cases that we have locally in school-age children, which I spoke of before. There's data indicating that children have levels of virus in the respiratory tract that are actually as high as adults, and this would speak to their ability to transmit infection. We know that transmission to children is less, but children seem to have a lower susceptibility. There's new information that children actually do transmit infection at rates higher than we thought, especially within the household setting. And the number of students that are actually cared for by grandparents in the community, another data point that came into play with their increased risk of severe illness and an increased risk of hospitalization and stress on the system.
Okay, the public health authorities in Tarrant and other Texas counties have issued orders like the one Mclennan County did on Tuesday, with the start of in-person school set at September the 24th. Is there a chance the in-person starting date of September the 8th start date could be pushed back later? And if so, what considerations will you be looking at to possibly extend to a later date?
That would certainly depend on the level of activity of COVID-19 as time goes by. The prediction would be that with the effect of efforts ongoing, that we'll see a decline in activity over the next 6-8 weeks and keep us below a level of concern, and it would only be a considerable unexpected increase or a failure for the number of cases and hospitalizations to go down that would cause that to be reconsidered.
Okay. Did the termination of Dr. Brenda Gray, the former director of the Waco Mclennan County Health District, have anything to do with the timing of Dr. Werner's order? And can you discuss the reason for her being let go?
Well, first, regarding the reasons for her being let go, it's important for the public to understand that the city of Waco is organized by our charter as a city manager form of government. That means that Dr. Werner, as a department head, reports directly to our city manager's office. So it's, as mayor, as mayor, it's not appropriate for me to comment on or discuss personnel matters. So any further questions regarding that matter should be directed to the city manager's office, and that's Bradley Ford and his assistants. I can tell you, though, that Dr. Gray's departure had nothing to do with the timing of Dr. Werner's order. The timing of those two items were just completely coincidental.
What's going to happen now that the health director for Mclennan County has been let go?
Well, Larry, like most health districts across the state, our health authority our health authority in Dr. Verner is a physician. In fact, he's, as I said earlier, a highly respected infectious disease specialist, and therefore he is perfectly qualified for this role. He has taken the lead on all medical responses related to COVID-19 at the health authority. The director of the Waco Mclennan County Health District is, by contrast, a management position. And the assistant city manager, Deidre Emerson, along with management staff at the health district, will be working to manage the important and excellent work that is continuing to be done there by the approximately 80 employees of the health district who work there. We've got a great team there, and our city management will be working with them, and our city management will be working diligently to fill the role of health district director.
Okay. 85 babies have COVID in Corpus Christi in Oasis County. What can we do to protect our young children?
Dr. Griggs, would you mind taking that?
Sure. First, for context around how the disease affects children and infants. In a study that examined all the hospitalizations that occurred in late winter, early spring in the United States, less than 1% of all of the individuals hospitalized with COVID-19 were children. And critical disease only occurred in 1 of every 167 children who were confirmed positive cases of COVID-19. So while it's important to recognize that children act as carriers of the virus to health vulnerable individuals, children themselves are, for the most part, not those at highest risk of severe disease. Saying that, when severe disease does occur in children, it is most often in children less than 1 year old. So to protect our newborns and infants, there are a few things that we can do that are prudent. First, if you're pregnant and have symptoms, don't delay seeking diagnosis and care. The CDC now has protocols for managing mother-baby care during the labor and newborn period, and the hospitals are familiar with these protocols. Similarly, if there's a child who's less than 1 year old in your household, and in particular, if it's a child with congenital heart, lung, liver, kidney disease, and anyone in the household has symptoms of COVID-19, it's really important that the child at risk is protected from the individual in the home with symptoms. Sometimes this may even mean a brief period of separation from the infant. So seeking medical care and advice promptly is imperative, because there's not a sort of one-size-fits-all approach here. If you're a family with a newborn, particularly if you have just returned from the hospital, remember that you pose a risk to a visiting grandparent. So be aware that the hospital is a location where you could actually acquire the virus, and then bringing that home to a grandparent poses risk. And grandparents could conversely pose a risk to a newborn. So if a face-to-face visit is really important and everyone is healthy, both the family with the newborn and the grandparents or other family members who want to visit can all quarantine for 2 weeks and then get together for close contact. And I think we all just have to remember that we share the responsibility as a community in protecting our community's newborns, just like all other health vulnerable individuals. And the same approach applies in our work to get the numbers down, to get the new cases down in order to protect the health vulnerable. Masking, physical distancing, avoiding crowds, avoiding indoor spaces that have lots of individuals in them. Hand hygiene, all of those things make a difference in bringing the numbers down, which protect our health vulnerable.
Okay, field hospitals are set up in Houston and Austin. Are there any plans to set up one in Waco, and where would it be?
Muted myself. What we're talking about there is an alternate care site. Our current site is the Highlands Gym at MCC, and we're really grateful to MCC for making that site available to us as a community. TSTC has also offered a site on their campus. Our staff is continuing to look for other alternative care sites to see if we can find one that would be easier and less expensive than would be to stand one up in a gym like MCC's, and that also would not inconvenience the students at one of our higher learning institutions. But currently we have the plan for MCC. We are told that the alternate care site could be stood up in a week's time. We don't currently anticipate needing that. And so we will continue to work and be sure that we are prepared in the event that cases begin to rise again at an acceptable rate, and we have to start thinking about standing that up.
Refrigerator trucks have been sent to cities across Texas. Does Waco have any of these trucks?
We do not. We have access to two refrigerated trucks, which could be used for mortuaries within our region. One of them is currently in Austin. Our emergency management folks are in contact with the local funeral homes and don't see any need for that in the immediate future.
Okay. Where and how are the majority of people getting infected?
Dr. Werner, can you speak to that? You're muted, Dr. Werner. You made the same mistake I did.
There was a siren going by out there. At this time, the predominant spread in the community is likely a combination of household contacts and social contacts, the gathering of families and friends in situations where you may feel safe and the compliance and acceptance of mask use falls off, and that's a high risk situation. The effect of social distancing in public is helping, and we still have plenty of cases that are without a specific source, just general community spread. But at this time, the way we can effectively reduce the spread in our community is a wider acceptance of the concept of mask use and social distancing in all situations, not just when you're out in a business or in the workplace.
How is the health district working with the schools relative to COVID-19?
Going forward, we'll be having a weekly phone conference with school administrators and representatives from the public health district regarding COVID-19 plans and ways of implementing measures to provide as safe as an environment for the students, the teachers, and staff that we can.
Okay, the mask ordinance have been in place for more than a month. The governor's mask order and halting of reopenings are 3 weeks old. The numbers are not going down. Talk about why as specifically as you can.
Well, I think the reality is we are starting to see signs that the numbers are going down, as we showed earlier in the charts. And I think, again, as Dr. Griggs mentioned regarding the RT value. But I'd like to ask Dr. Berner to talk a little bit about the delay between the time that you implement a change in behavior and you see results in the case numbers.
So there is definitely a difference between what's reported on the new case count as there's a time lag between when the actual test is done and when that gets reported to the health district and shows up as a new case. That time frame is about 6 days on average now. And there's a time delay between when a patient develops symptoms and when they get their test done. And on average, we're seeing that that's a good 3 days or so. And that date of onset of symptoms is on average about 5 days after they have their exposure. So those new case counts actually reflect the activity and transmission, the spread of the virus closer to 14 days ago.
Okay, Mayor, you talked about the field hospital situation earlier, but how close are the hospitals we have to being full?
Well, as we've said before, the three of us, as well as Judge Felton, are on calls at least 3 times a week now with the hospital administrators, talking to them very specifically about where they are with capacity. And as we've discussed before, their capacity is somewhat it's somewhat unlimited. It's not unlimited, but there is not a hard limit right now on on the number of ICU beds and such, because they have created. The situation is very different from what it was back in March. They have created contingency spaces. They have spaces that they are leaving open that can be stood up as ICU beds. And if those fill up, that's about double their normal number of ICU beds. If they fill that up, they still have capacity to stretch beyond that. It would simply be a matter of getting enough vents and having enough personnel in terms of experts who can run those vents for patients. So it's not they are not nowhere near that at this point. What we continue to hear is that their staff is stressed. Their staff is being stretched beyond their normal workload, and they are worn out. Many of them or several of them have become infected with COVID-19 or have been exposed in a way that they're having to sit out for a while. And so they're experiencing some of the impacts that our workforce all over the city and the county are. But then you add the stress of working every day with folks who are COVID positive, and it's obviously a difficult situation for them.
The CDC is no longer taking reports from hospitals. How does this affect Waco McLennan County?
Dr. Griggs, can you speak to that?
Yeah, so this question pertains to the policy that was implemented last week, national policy, where the U.S. Department of Health and Human Services instructed hospitals to report COVID-19 cases and deaths and other details directly to their agency, so directly to HHS rather than to both HHS and the CDC. This was an attempt to simplify the reporting process and the national response. And as a result, the CDC will receive data from HHS rather than directly. Hospitals will only have to submit information to HHS, and they'll use a portal run by a private technology contractor called Teletracking. And most experts are not really sure how this will impact the national COVID-19 response. There are some concerns that the CDC is getting a little bit sidelined here, and that a change in reporting and data management right now could lead to some unintended complications, particularly for hospitals that might have to work with and learn new technology. But perhaps the most immediate implications are that researchers and public health officials, maybe journalists who have used the CDC's relatively easily accessible coronavirus data might find access a little more challenging. Beyond that, and maybe some hospital staff having to adapt to the new portal, I don't see any immediate implications for our community's health with this change.
Okay, a little more lighthearted here as might be. Should people go on vacation?
Dr. Griggs, I think you talked about this a while back, but would you speak to that again, please?
Yes, absolutely. So intrinsic to most travel is more contact with non-household members. So for those who have an increased risk of severe illness from COVID-19, and for household members of those who have increased risk, the recommendation is to limit travel to only what is essential. For anyone though who travels, remember to take enough masks and wear them when you're with any non-household members in public or otherwise. So if you're visiting family and you're indoors, you really should be wearing a mask and staying 6 feet away from those family members who aren't household contacts. And that is true even if you're in one of those 22 states who don't require masks. So even in areas where it's not a rule to wear a mask, you should still wear a mask. I think that staying in someone else's household does pose substantial risk, and so my own recommendation would be to, if possible, if you feel compelled to travel, and again, assuming you're not someone at high risk, would be not to stay within somebody else's home, but to stay at a hotel, and make sure that is when you come in that you bring your Lysol or your whatever kind of sanitizing wipes you have, wipe down all of the high touch surfaces in that hotel room that you're using, and really when you arrive at your destination, be very mindful that even though you're on vacation and you're at a destination site, the same physical distancing practices, the same avoidance of crowds, again, even in states where restaurant capacity or bars aren't closely regulated, it's imperative to avoid those places that pose the highest risk. So I would in general suggest against travel, but if you feel compelled and you're not at a high risk or not one of those vulnerable individuals, and no one in your household is vulnerable, then just take ample steps to make it safe. And one other point to make, and that is when you traveling alone in a car or with household members in a car is far safer than travel via plane, and certainly via bus. So I would encourage you to travel in your own car exclusively with household members.
Okay, what is the rule on wearing face masks outdoors?
So Larry, the rule for face masks outdoors comes from the governor's order, which requires that you wear a face covering over your nose and mouth, even outdoors if you are in an area where you can't maintain 6 feet of distance from the others around you who are not in your household. So specifically in Cameron Park and places like that where we have We have some wide trails. We also have some narrow trails. If there are lots of people, if there are others out there walking, I won't even say lots of people, if there are others out there walking those trails and you encounter them, you need to have a mask and put it on, either pull it up or put it on as you pass those people. It's not only because it's the governor's order, it's primarily because it is good public health practice and it will keep them safe from you. And there is rising data that indicates that it may also keep you safe from them. So specifically in Cameron Park, if you're going to be on those trails, have a mask or a buff neck gaiter either with you or on that you can pull up when you get around other folks.
Okay. All right. If you get sick and get tested and have a positive result, when will you know that you're negative, that you have completely come through it and are not a risk to others anymore? And do you get a second test?
Dr. Griggs, would you mind speaking to that?
Absolutely. So the contagious period and then whether or not a follow-up test is required. Let me first review some numbers with you, some timing issues with you. The incubation period, you heard Dr. Werner refer to this. The incubation period, so the time from exposure to onset of symptoms, can be anywhere from 2 days to 2 weeks, the average being around 5 days. Remember that people can be contagious and transmit the virus during the incubation period, and because they don't have symptoms, they won't know that they're contagious. Incidentally, once symptoms occur, the expected course of illness, if it's a mild illness, is around 2 weeks. For those who are more severely affected, it can be 3 to 6 weeks of illness. So specifically the contagious period, this is among individuals who have non-severe COVID-19 and are not immunocompromised. They can spread the virus from that pre-symptomatic period up to 10 days following the onset of symptoms. So pre-symptomatic period all the way through 10 days following the onset of symptoms. And some individuals with severe COVID-19 have been known to spread the virus for up to 3 weeks. So those are people who have been in the hospital, in the ICU, perhaps intubated. They can spread the disease longer. So if you have had mild to moderate illness and are not in that immunocompromised category, your immune system is not diminished because you're a solid organ transplant, a liver kidney transplant patient, or on medicines to treat lupus or rheumatoid arthritis. So the clinical criteria for considering yourself no longer infectious to others, there are 3 factors, and all of those must be met. At least 10 days since the onset of symptoms, 24 hours since the last fever, and it's important to recognize that that's 24 hours without fever and not taking medicines that would reduce a fever, medicines like Tylenol or ibuprofen, Advil, Motrin, or aspirin.
It's 3 days without fever. I'm sorry.
Oh, okay. Thank you. 3 days. The CDC updated healthcare professionals now being 24 hours, but 3 days for the rest of the population. Thank you, Dr. Werner. And symptoms such as cough or shortness of breath have clearly and consistently improved. So 10 days since onset of symptoms, 3 days since last fever off of medicines that could lower the fever, and continuous symptom improvement for cough or shortness of breath. And individuals who meet all 3 of these criteria can be considered no longer contagious. They don't need a test to confirm that they're no longer contagious. It is not uncommon that someone who has had the coronavirus, that even in that period after which they're no longer contagious, still can have a positive test. So So repeat testing is not something that that is recommended. And if you've had a severe or critical illness, you'll be in contact with a physician. And so I would seek your physician's advice on when you're no longer contagious, if you're in that category of severe or critical illness.
Okay, I think we'll let this be the last question I ask, and then we'll turn it over to the mayor to have the media ask questions. Is it true that hospitals have gotten better at treating this disease? And if so, why and how?
Dr. Griggs, would you speak to this also, please?
Absolutely. So there have been almost 40,000 papers published on COVID-19 in peer-reviewed journals since the onset of the pandemic, and the medical community's understanding of the virus and the clinical illness COVID-19 is growing on a day-to-day basis. Supportive measures, proning and early intubation and high flow oxygen and use of anticoagulation, these are things that are now being applied on a much more routine basis that have improved outcomes some, and there's some emerging therapies like dexamethasone and remdesivir and convalescent plasma that have some evidence of improving outcomes even beyond that. So those factors, and then hospitals have been aggressive with developing protocols for treatment, which ensures a systematic approach to patient care, and all of those factors come to play in the improvement in hospital outcomes.
Okay, well, let's stop there. And I think we have 3 or maybe 4 media representatives on the line, Mayor. And if you will, I'll let you take charge and invite them to ask questions.
Hey, great. We'll take a couple of questions from each of you if you have them. I will start with Rhiannon Sagert at the Waco Trib.
Let me get her unmuted. Okay.
Hello. How many cases have been among healthcare workers cumulatively? And if you have it broken out, how many current cases are among healthcare workers?
Dr. Griggs or Dr. Werner, do you have that information?
I haven't seen that
I
number.
don't have an exact count, no. We can certainly get that and have it for the next session.
Okay, we'll see if we can get it for you even before that, Rhiannon. But if not, we'll try to have the answer next Wednesday. But we'll see if we can get it quicker than that. I'm seeing Richard Richardson from Edwards Media. I believe that's 94.5 The Beat. Richard, are you there?
Richard, can you hear us? Are you unmuted?
Mike's not on. He's still muted.
I can try to contact Richard on the side, Mayor, if you want to go. The next number is Megan's number.
Okay, all right. We'll move to Megan Vanslow from KWTX. I may have said that wrong.
Okay, can you guys hear me?
Yes, we can.
Okay, perfect. Can you talk a little bit about the science? I know you addressed some of it earlier, but just the science that went behind the decision to postpone the opening of schools and how the school environment differs from other public gatherings that are still allowed to go on.
Dr. Werner, can you speak to that a little bit?
Yes. I'm sorry, pose it again.
Can you speak to some of the science behind the threat that you're seeing could occur when students go back to school and how that differs from other public gatherings that are still allowed to be taking place?
Well, I don't say that there's necessarily a difference. It's just that what we've been doing, what we did was open up, and we had a dramatic increase in number of cases when we increased the number of interactions between people. With reopening of in-person schools, you have what's likely a lesser risk of transmission than in those other situations. And yet, with the ongoing transmission in those other situations, when we add in additional cases, additional risk from, in essence, another reopening, even though it's of lesser risk, then that puts us at a higher likelihood of initiating another round of cases within the community, and then the subsequent spread through households and other close contacts.
Okay, did we ever get Richard Richardson on the line?
Yes, he said he's good with questions. His mic was stuck, but he doesn't have any questions at this time.
Okay, all right, very good.
I have a
Rhiannon.
second question. That's
Oh,
okay.
yeah, go ahead, and then go ahead and ask your question, then we'll return to Rhiannon, Megan.
Thank you so much. Do you have anything to say to address some of the legal challenges or speculations of legal challenges for the local health department to be issuing this order because it didn't come through the TEA?
I think I can speak to that, and Dr. Werner may have something to add. You know, the health authority has the specific authority for the county, and that is, it's a matter of state law. It is not just applicable to schools. And so I don't think that there is any requirement of TEA involvement in making that order, passing that order. Dr. Werner, do you have anything different on that?
I don't believe the TEA necessarily has the authority to close schools. And yes, the Texas Health and Safety Code and Texas Administrative Code specifically delegate that authority to local health authorities in the situation of spread of infectious disease.
Okay, thank you. Rhiannon, did you have another question?
Yes. If we're delaying the physical return to schools because of a concern about spread, how much of a risk do daycares pose in comparison?
Go ahead, Dr.
Yeah, daycares are similar risks and potentially greater risks, but again, that has been ongoing, and we're looking at things to do to influence the upcoming spread in addition to that.
You know, one thing that I would add regarding schools, a piece of data that was shared with me is that in Waco and Mclennan County, over half of grandparents, so 3,070 grandparents in Mclennan County, are responsible for taking care of their own grandchildren under 18 years old. So you have grandparents who are likely in the vulnerable population taking care of kids who are going to school and bringing it, potentially bringing it home. And that's that's something that Dr. Werner hasn't mentioned, and I don't know whether that was something that you considered, but I think that's something the public should consider as we talk about reopening schools. I think we all understand that in school is important, having kids in school is important, having them participating in sports and other extracurricular activities. There's a reason we've done that for forever. It's important for those kids. We're balancing priorities at the moment. and trying to do our very best to navigate through uncharted waters. And so I would just ask that everybody be patient and that let's work together through this. And we will continue to get there, but hard decisions have to be made. Dr. Werner, I think it appears to me, Dr. Werner, although I've never really understood and had to think about the health authority question, your position in the past, that is intentionally set up by the state in a way where you are independent of political influence from the mayor and city council and the judge and the county commissioners and each health district and their board, because you have to make decisions based on medical science. And you shouldn't have influence from those of us who have other potential agendas. I guess that's a statement more than a question, but is that your understanding of the way that this is set up under state law?
Yes, exactly.
Okay, thank you. Larry, I'll turn it back to you, and then we'll finish up with closing remarks.
Okay, thank you. Well, we'll wrap up with closing statements if we want, and we'll go in the order that we started out originally. We'll let Dr. Werner go first, then Dr. Griggs, and follow it up in closing with our Mayor, Kyle Deaver. Dr. Werner, would you like to make some closing comments?
I had no additional comments.
Thank you, Dr. Werner.
Dr. Griggs.
Let me start by just a plea to anyone who has symptoms and goes to get evaluated. If you get tested and there's a wait to get your test results back, please self-isolate until you get your test results back. If you have had symptoms and a clinician is concerned enough to test you, then consider yourself infected until proven otherwise. That way you protect your immediate community and the community as a whole. And if you happen to end up getting negative results, hopefully it'll be accompanied by an all clear from your clinician. Certain circumstances, even a negative result, you may still need to follow a clinician or the health district's instructions. But in most cases, a negative test, you'll be given the all clear and won't have to continue your self-isolation. But really in that period of time between testing and the results, be sure to self-isolate and don't continue to sort of do life as normal, because you can spread the virus if you do have it, even during that period when you're waiting for results. To reinforce something stated earlier by Dr. Werner, you are right now likely more probable to get it's more probable that you'll get the virus from someone you know than someone you don't know. So those that extended family gathering or that party that you're tempted to go to, avoid it. Even if it's people you know and you feel comfortable with, it is really imperative to recognize that just by knowing someone, it doesn't mean that they can't give you the infection. And remember that asymptomatic individuals, people without symptoms, can spread the infection. And then finally, just an ongoing word of gratitude for our city and county leadership that has, there have been a few moments where decisions have been made where it has felt challenging for the community. And then in retrospect, looking back, I think we have all felt a sense of gratitude that those hard decisions were made. And so my sense is the school decision that's been made is going to be just like decisions that have been made previously by our mayor and our county judge, where the time it was challenging, and then in retrospect we looked back and we said, thank goodness, because it kept a difficult situation from getting much worse. So gratitude for those of you who are having to make some very difficult decisions right now when much is uncertain.
Mayor Deaver.
Thank you, Larry. Again, I want to thank you and your team, and Esmeralda and the city secretary team, and Kelly Crane and the staff at the Health District for the great work that you continue to do. Thanks for helping us bring this information to the public. And Kelly, for you and your team, really thanks for just the continuing great work that y'all are doing at the Health District to keep our community safe, not only from COVID-19, but with regard to all the other work that's ongoing that has been overshadowed right now by this pandemic. Dr. Verner, thank you again for taking the time to be here today and for serving as our Waco McLennan County Health Authority. It is a critical role that many of us have not up until now understood. And we appreciate you being willing to serve in that role in addition to your regular duties as a practicing physician here in Waco. Dr. Griggs, thank you again for being here and helping us answer the health questions. It's always great to have you, and we appreciate it. I want to clear up one thing. I may have misspoken as I was trying to explain Dr. Verner's position as opposed to the director of the Public Health District. If I said Dr. Verner was the director of the Public Health District, that was a mistake. Dr. Verner is not the director of the Public Health District. He is our McLennan County Public Health Authority. He's a physician. The director of the Public Health District is by distinction a management position over the Health District and all the employees there at the Health District. So I apologize if I misspoke during that answer earlier. I want to remind you to fill out your census and how important that is to our community. And I want to ask you to continue to pray for the victims and the families of the victims who have died. We have lost 25 people from our community now, and every one of those is a significant loss. So please pray for them and for their families, and your continued prayers for our frontline healthcare workers, who, as we've talked about today and for the last several weeks, are under tremendous stress and strain, and they are doing their job, keeping up all of us healthy and safe. I ask that you please continue to take care of yourself and take care of each other, and that means staying at home as much as possible. Wash your hands often. If you need to get out, keep your distance and wear your mask. If we can continue to do that, we will get through this. We are making progress towards getting back to a more normal situation. We will get through this together. Thank you.
I want to thank all three of you, especially Dr. Verner, for joining us today, especially under the pressure or whatever that you've been under, and we hope that has answered a lot of questions. I do want to let everybody know, if you have additional questions, we have on our wacocovid.com website, right on down toward the middle in red type, it says, for questions about the order regarding schools, you can email an order in there, a question in there, and it will be answered by a health official. Also want to remind everybody that there will be free testing starting next week on the 27th, and we'll be putting out that information not only to the media people, but we'll post that as well on our wacocovid.com website, which is full of information. I invite you to check that out for it. We thank all of our three participants, always giving the extra time that they do to be here to help our community understand what's going on. And everybody's got different attitudes on different things, but it's a common thing. We want to get over this. And wearing a mask is, without question, the proven thing, and we want to encourage that. Thank you all for joining us, and have a good day.